Think about the simple act of breathing. We take it for granted, yet it's essential for life. But have you ever stopped to consider the amazing journey air takes before it reaches your lungs? The nasal cavity, often overlooked, is the unsung hero of this process. This intricate space behind your nose is much more than just a passageway for air. It acts as a powerful air filter, a sensitive smell detector, and a vigilant guardian against harmful invaders. In this exploration, we'll uncover the fascinating world of the nasal cavity and understand its crucial role in our overall health. From the moment you inhale, your nasal cavity springs into action, ensuring that each breath is clean, warm, and ready to fuel your body. So let's delve deeper into the remarkable functions of this often underappreciated part of our anatomy. Imagine the nasal cavity as a small room with curved walls. These walls are formed by bones and cartilage, giving your nose its unique shape. The nostrils, or nares, are the entry points of this room, welcoming air from the outside world. Inside the nasal cavity, 3 bony ridges called turbinates protrude from each side. These structures increase the surface area, maximizing contact with the air we breathe. Below each turbinate lies a corresponding air passage known as a meatus. The nasal septum, a thin wall of cartilage and bone, divides the nasal cavity into 2 symmetrical chambers. This separation is crucial for proper airflow and optimal functioning of the nasal passages. Lining the entire nasal cavity is a specialized tissue called mucosa. This moist lining plays a vital role in preparing the air for its journey to the lungs. The mucosa secretes a sticky substance called mucus, which acts like flypaper, trapping dust, allergens, and other foreign particles. This mucus layer is constantly on the move, propelled by tiny hair-like structures called cilia. These cilia beat rhythmically, moving the mucus and its trapped debris towards the back of the throat, where it is swallowed or coughed out. This continuous cleaning process ensures that the air reaching your lungs is free from harmful irritants, highlighting the nasal cavity's crucial role in respiratory health. Have you ever noticed how cold air feels harsh on your lungs, while warm air is more comfortable to breathe? That's because the nasal cavity acts as a natural air conditioner, regulating the temperature and humidity of the air we inhale. As air travels through the nasal cavity, it comes into contact with the warm, moist mucosal lining. The turbinates, with their increased surface area, play a key role in this process. They allow for efficient heat exchange, warming cold air and cooling hot air to a more comfortable temperature for your lungs. This humidification and warming process are essential for optimal lung function. It prevents the delicate tissues of the respiratory system from drying out, ensuring efficient gas exchange and overall respiratory health. Section 5. The power of scent, olfaction explained. The nasal cavity is not just about breathing, it's also the seat of our sense of smell. High up in the nasal cavity, tucked away in a small area called the olfactory region, lies a specialized patch of mucosa called the olfactory epithelium. This region is home to millions of olfactory receptor neurons, each equipped with tiny hair-like projections called cilia. These cilia are covered in odorant receptors, which bind to specific odor molecules in the air. When an odor molecule binds to its corresponding receptor, it triggers a signal that travels along the olfactory nerve to the brain. The brain then interprets this signal as a specific smell. This intricate process allows us to experience the vast and nuanced world of scents, from the sweet aroma of flowers to the savory smell of freshly baked bread. Section 6. Guardians at the Gate. Immune defense. The nasal cavity serves as the first line of defense against airborne pathogens. The sticky mucus lining not only traps dust and allergens, but also acts as a barrier against bacteria, viruses, and other harmful microorganisms. Embedded within the mucosa are specialized immune cells that constantly patrol the nasal cavity, searching for invaders. These cells, including macrophages, neutrophils, and lymphocytes, are equipped to recognize and destroy pathogens, preventing them from reaching the lungs and other parts of the body. The nasal cavity also contains lymphoid tissues, such as the adenoids, which are part of the immune system's network of lymph nodes. These tissues play a crucial role in filtering lymph fluid, trapping pathogens, and initiating an immune response. Section 7. Sinus SOS. When sinuses go wrong. Surrounding the nasal cavity are air-filled cavities within the skull bones known as paranasal sinuses. These sinuses, lined with mucosa similar to the nasal cavity, are connected to the nasal passages through small openings. The exact function of the paranasal sinuses is not fully understood, but they are thought to contribute to voice resonance, lighten the weight of the skull, and possibly provide additional air filtration. However, these sinuses can also be prone to inflammation and infection, leading to a condition known as sinusitis. Sinusitis occurs when the openings between the sinuses and the nasal cavity become blocked, often due to allergies, colds, or other irritations. This blockage can trap mucus within the sinuses, creating a breeding ground for bacteria and viruses, leading to pain, pressure, and other uncomfortable symptoms. Section 8. A crooked path, deviated septum. Remember the nasal septum, the thin wall that divides the nasal cavity into two chambers? Ideally, this wall is straight, allowing for equal airflow on both sides. However, in many people, the septum is deviated, meaning it's crooked or bent to one side. A deviated septum can be present at birth or develop later in life due to injury or trauma. While a slightly deviated septum may not cause any noticeable problems, a more severe deviation can obstruct airflow, leading to difficulty breathing through the nose. This obstruction can result in nasal congestion, snoring, sleep apnea, and an increased susceptibility to sinus infections. In some cases, surgical correction may be necessary to straighten the septum and improve airflow. Section 9. Polyps and allergies, nasal obstacles. Nasal polyps are soft, painless, non-cancerous growths that can develop on the lining of the nasal cavity or sinuses. These teardrop-shaped growths are often associated with chronic inflammation, such as that caused by allergies or chronic sinusitis. Nasal polyps can obstruct airflow, leading to similar symptoms as a deviated septum, such as nasal congestion, difficulty breathing, and a reduced sense of smell. Allergic rhinitis, commonly known as hay fever, is another common condition that affects the nasal cavity. When someone with allergies inhales an allergen, such as pollen, dust mites, or pet dander, their immune system overreacts, releasing histamine and other chemicals that cause inflammation in the nasal passages. This inflammation leads to the classic symptoms of allergic rhinitis: sneezing, runny nose, itchy eyes, and nasal congestion. Section 10. Chronic sinusitis, a persistent problem. While acute sinusitis, often caused by a cold or viral infection, typically resolves within a few weeks, chronic sinusitis persists for longer than 12 weeks, despite attempts at treatment. This persistent inflammation of the sinuses can be caused by a variety of factors, including allergies, nasal polyps, a deviated septum, or other underlying medical conditions. Chronic sinusitis can significantly impact quality of life, leading to facial pain, pressure, nasal congestion, a reduced sense of smell, and fatigue. Treatment often involves a combination of medications such as nasal corticosteroids, saline irrigation, and in some cases, surgery to improve sinus drainage. Section 11. Conclusion: breathe in, breathe easy. The nasal cavity, often overlooked, is a remarkable part of our anatomy. It's a powerful air filter, a sensitive smell detector, and a vigilant guardian against harmful invaders. From the moment we inhale, this intricate space works tirelessly to ensure that each breath is clean, warm, and ready to fuel our bodies. Understanding the anatomy and functions of the nasal cavity allows us to appreciate its crucial role in our overall health. By recognizing the importance of proper nasal care, we can help keep this unsung hero functioning at its best, allowing us to breathe easy and experience the world with all our senses. So the next time you take a breath, remember the amazing journey of air through your nasal cavity and appreciate the intricate workings of this often underestimated part of your body.